Hello students, myself Muthamil Selvan, Department of Anesthesia and Operation and Technology, Assistant Professor, School of Health Science, Vinaya Missions Research Foundation, Salem. Today we are going to discuss about local anesthesia. Local anesthesia are the drugs which upon topical application or local injection cause reversible loss of sensory perception, especially of pain in a restricted area of the body. Local anesthesia typically you can see in normal day-to-day life. It can be used antacid as well. They block generation and conduction of nerve impulse at any part of the neuron without causing any structural damage. Thus not only sensory but it also blocks motor function also. It is injected around the nerve and it can cause muscle paralysis and loss of autonomic control as well. This is classification of local anesthetics. Injectable and surface anesthetics. These are two groups. Mainly low potency and short duration. In this classification, procaine and chlorprocaine. Intermediate potency and duration, lidocaine and prilocaine. High potency drugs are tetracaine, bupivacaine, ropivacaine and dubicaine. Surface anesthetics are subdivided into two classes, soluble and insoluble. Soluble there are cocaine, lidocaine, tetracaine, procaine. Insoluble substance are benzocaine, butyl amino benzoate and oxygen. Next we are going to move on mechanism of action. Local anesthetics are typically ionized outside the cell, then enters into the cell, it ionized and binding with sodium channel. Then it decreases the sodium conductance. Depression of rate of electrical depolarization and then failure to achieve threshold potential, lack of development of action potential. Without action potential, nerve impulses are suppressed. This is detailed picture of mechanism of action. Here you can see sodium ionized and enters into the cell. Then it binds with sodium receptor and it blocks the sodium channel. Afterwards sodium cannot enter into the cell. So neural transmission is blocked. So any sensory or motor information will not be carried up to the neurons. Here is the action potential diagram. Here you can see this is resting membrane potential. Up to this sodium is slowly entering into the cell up to threshold. After threshold, all sodium enters rapidly into the cell and causes the depolarization. After depolarization, repolarization occurs. Potassium ions exit out the cell. Afterwards it comes to up to resting state. Sometimes it may have hyperpolarization. In this local anesthesia mechanism of action, sodium channels are blocked, so cell cannot achieve the threshold potential, so it does not cause depolarization and repolarization. Action potential does not occur, so nerve conduction is stopped. Systemic actions of local anesthetics. In CNS, local anesthesia does not got any action, but cocaine causes euphoria, excitement and mental confusion, restlessness, tremor, twitching of muscles, convulsions, unconsciousness and respiratory depression. Sometimes it may cause even death. Cardiovascular system, local anesthetic cause cardiac depressant and blood vessel. It can reduce the blood pressure by vasodilation. Local anesthetics. Clinically, local anesthetic have no or minimal local irritant action and block sensory nerve endings. They also reduce release of acetylcholine from the motor nerve endings. Injected around the mixed nerve, they cause anesthesia of skin and paralysis of voluntary muscle supplied to the nerve. Adverse effects of local anesthetics. CNS effects are light headache, dizziness, auditory and visual disturbances. mental confusion, disorientation. This can be prevented and treated by diazepam. Cardiovascular toxicity is the main adverse effect in local anesthesia. It causes bradycardia, hypotension and cardiac arrhythmias. Hypersensitivity reactions like rashes, angioedema, dermatitis, contact sensitization, asthma, and rarely it can cause anaphylaxis. Lignocaine is one of the drugs in local anesthetics. It is introduced in 1948. It is currently the most widely used local anesthetic drug. Injected around the nerve block conduction within 3 minutes. It can be seen even in the suturing and small procedures. Lignocaines are used mostly. Lidocaine 2% without or with adrenaline is most popular dental anesthetic. The early central effects of lidocaine are depressant. Example, drowsiness, mental clouding, dysphoria, altered taste and tinnitus. Overdose causes muscle twitching, convulsions and cardiac arrhythmias, fall in blood pressure, BP, coma, respiratory arrest. Adrenaline is added with lignocaine because it can increase the duration of action of lignocaine. Formulations of lignocaine. Lignocaine brand name is xylocaine. 4% topical anesthesia, 2% jelly. Jelly is used to place ET tube and some urocatheter cases. 5% ointment. Ointment used in topical anesthesia for pain. 1% and 2% injection mostly used in nerve blocks with or without adrenaline. And 100 ml sprays are mostly used in mucous membrane. Techniques of local anesthesia: surface anesthesia, infiltration anesthesia, conduction block, spinal anesthesia, epidural anesthesia and intravenous anesthesia or Bayer's block. In surface anesthesia, only topical application of local anesthetics are used, mostly in the mucous membrane. Only the superficial layer is anesthetized and there is no loss of motor function. Example, lidocaine 10% sprayed in the throat acts 2 to 5 minutes, produces the anesthesia for 30 to 45 minutes. Infiltration anesthesia. Diluted local anesthetic solution is infiltrated under the skin. Example, lignocaine, its duration of action is 30 to 60 minutes and bupocaine's duration of action is 90 to 180 minutes. Infiltration is used for minor procedures. Example, incisions, hydrocele, herniopry. When the area to be anesthetized is small. Conduction block. The local anesthesia injected around the nerve trunk so that the area distal to the injection is anesthetized and paralyzed. Lignocaine 1 to 2% with shorter duration of action is most commonly used for conduction block. There are two types in conduction block. One is field block, another one is nerve block. Field block is nothing but it is pursued by injecting the local subcutaneously in a manner that all nerves coming to a particular fields are blocked. Nerve blocks are common in orthopedic surgeries. It is produced by injecting a local anesthetics. The appropriate nerve trunks are flexus. Example, brachial plexus or femoral nerve block. The area of resulting anesthesia is larger compared to amount of drug is used. Muscle supplied by the injected nerve or plexus are paralyzed. It is the most common method of local anesthesia. It is also called regional anesthesia. Spinal anesthesia, it is one of the sub-branches of regional anesthesia. Most surgeries used by spinal anesthesia. The local anesthesia is injected in the subarachnoid space between L2 and L3 or L3 and L4 below the lower end of the spinal cord. Above the L2 it is dangerous because spinal cord most of the branches are supplied above the L2. So less than L2 space is more safer to give spinal anesthesia. Lower abdomen and hind limbs are anesthetized and paralyzed by spinal anesthesia. Spinal anesthesia is used for operations on the lower limbs, pelvis, lower abdomen. Example, fractures and obstructive surgeries. This is nerve supplies of spinal nerves. Here you can see we are giving spinal anesthesia in this region. It can block the nerve supply below the local anesthesia is injected. Epidural anesthesia is another subclass in regional anesthesia. Spinal anesthesia, we inject the local anesthesia drug one time only. In epidural anesthesia, we place a catheter into the epidural space and we continuously infuse the local anesthetic drug into the epidural space. It is mostly used in post-operative pain management. The epidural space is filled with semi-liquid fat through which nerve roots travel. The local anesthesia is injected into this space, acts primarily on the nerve roots. Here you can see spinal anesthesia. Here you can see epidural catheter. In this catheter, the catheter is placed for around 5 to 7 days. We can continuously infuse when local analgesia is needed. Epidural anesthesia can be divided into 3 categories depending on the site of injection. The first one is thoracic epidural. Thoracic epidural is mostly used for CABG or thoracic region cases. It is used generally for pain relief following thoracic or upper abdominal surgery. Next, lumbar epidural. It produces anesthesia of lower abdomen, pelvis, hind limbs. Use of lumbar epidural anesthesia is similar to that of spinal anesthesia. Lumbar epidural is most common in obstetric surgeries like cesarean section. Then caudal anesthesia. It is another type of epidural anesthesia. It is used for pediatric patients mostly. Injection is given in the sacral canal through sacral hiatus. It is used mostly for vaginal delivery, anorectal, genitourinary operations. Lignocaine 1 to 2% and bupivacaine 0.25 or 0.5% are popular drugs for epidural anesthesia. Here you can see sacral hiatus. Here we are giving the local anesthetic and it can paralyze the nerves below this. This is mostly used for pediatric patients because pediatric patients' spinal cord is undeveloped, so we can use caudal anesthesia. And the final part is intravenous regional anesthesia, also called as Bayer's block. It consists of injection of local anesthesia solution in a large vein of tourniquet occluded the limb such that the drug diffuses retrograde from the peripheral vascular bed into non-vascular tissues including nerve endings. It is mainly used for upper limb and for orthopedic procedures. This technique is mostly avoided in practice because it can cause cardiac toxicity if tourniquet is leaking or some other cases. Thank you for learning.